Hello, and thank you for joining us for our Fort Benning Garrison Facebook Live Town Hall. I'm Ben Garrett, your Public Affairs Officer and your moderator for this Town Hall. Our focus for this Town Hall is all about COVID-19, the COVID-19 vaccination, the current general order, specifications and any updates, and our HPCon status. Before we get to our questions and answers portion of the Town Hall, I'd like to introduce our panel today. Our panel is Major General Patrick J. Donahoe, the Maneuver Center of Excellence in Fort Benning Commanding General, Colonel Matthey Scalia, Fort Benning Garrison Commander, and Lieutenant Colonel Promotable Ethan Miles, the Maneuver Center of Excellence Command Surgeon. Major General Donahoe will begin our town hall with some opening comments. Before he does, I want to remind the audience, if you have some questions, please post them in the comment section of the feed so we can provide you a response. At this time, I'll turn it over to General Donahoe for some opening comments. Sir?
Hey, great. Hey, thanks, Ben. And for Colonel Scalia and Lieutenant Colonel Promotable Miles, hey, thanks for joining us for this, because I think this is pretty important time. Hey, so just to give us some context, right? So we're now back from holiday block leave about 2.5 weeks, and so we went through a concerted process to set the conditions for the soldiers, the trainees, and our cadre and our workforce to be able to take some time during the holidays to take time with family, to get the mental health break they needed. But we did that with a full understanding that we were going to expose ourselves to additional COVID risk. And so the planning then we put in place was the process of how to bring us back and to mitigate the risks that we knew we were exposing ourselves to. And I think when you look at what was done, I think we actually did very, very well. And given the conditions, when we returned, we were actually at the height of the pandemic in the 6 counties surrounding Fort Benning. And so the fact that we had put in place the control measures that we had were pretty good. And so, I've joked in public about we had to be in a kung fu stance when we got back from holiday block leave. And that actually works out as a pretty good metaphor because it's all about our ability to defend ourselves, but absolutely our ability to be on the offense as well, right? So the balance of a kung fu fighter, right? And so when we look at that, that's why we put in place General Order Number 7, went up to HPCon Charlie, and our ability to use those controls to both defend and then a series of measures to help us get on the offense against the virus. So again, HPCon Charlie meant we went to virtual schooling for the DODEA on the installation for the 2 weeks when we got back. Absolutely right thing to do. It allowed us as well to control the amount and the activities of not only the trainees coming back, but those coming back into our other schools. It allowed us to go to our training and doctrine command and move functional training starts like airborne school, ranger school, start those classes later, right? So we moved that past the Martin Luther King weekend. So it lessened our exposure to other vectors during the first 2 weeks. But again, we also had through that, we restricted movement. That was this 50-mile limit from the installation, which is increasingly popular, right? And the fact that you had to have a general officer, and there's only 3 of them on the installation approved going further than 50 miles. That was all about bringing us back down, hunkering down, lessening our exposure off the installation for the 2 weeks, right? Again, getting into a defensive crouch, a kung fu stance that in those first 2 weeks. Now, given the fact that we were at the height of the pandemic, we decided, hey, it was prudent to extend that 1 week. And so that's why we're still at General Order Number 7 right now into this weekend. And we'll talk about kind of how we're going to look at going forward. And so we put together a series of defensive measures that were really part of General Order Number 7 and HPCon Charlie. Now, on the offense, very, very robust testing capacity. And so we went after everybody coming on the installation as best we could to use the testing capacity we had to determine the state of the virus, of returning folks. And I think we've been very successful in doing that. And so when you look at that as an offensive measure, that's been effective for us. And then we also began our vaccination program the first weekend after the New Year's. And so, and again, we were able, through the gifted professionals at Martin Army Hospital and really team play from all the units in their medical capacity here on the installation, it allowed us to scale up our vaccination capability very rapidly. And so that's part of the offense, right? Let's test, let's know what we got, and then let's vaccinate as best we can. So again, really do appreciate the support from all of our community across the board, and the discipline that our family members, our soldiers, our civilians have shown, which has lessened our exposure to the disease, which has kept the rate of the disease, even at the height of the pandemic, for our Fort Benning community in a very, very manageable level. And so that's my opening comments, Ben. Appreciate it.
Sir, great. Thank you very much. Very informative, very helpful for the audience. Okay, we'll start our question and answers at a time. We've got several questions to get through. First one, many people are concerned with the speed at which this vaccine has been approved and distributed to the public. Dr. Miles, can you describe the process for how this vaccine was tested and approved for use?
Yeah, happy to answer that question, Ben. Thanks. So fortunately for the United States, we've got a process that's already in process and was in process well before COVID hit. And we've got an organization called the Food and Drug Administration who does this for a living full time with a large group of subject matter experts. So the process that happens is once COVID hit, researchers started working on a vaccine. After they develop the vaccine, what they'll do is they'll start going through different phases of research on the vaccine. So there's phase one, where they'll take a small group of healthy volunteers and they'll actually administer the vaccine to them. During that process, they basically look for safety, they look for side effects, and they look to see if generally this could be an effective thing. Once they pass through the phase one process, they go on to the phase two process. And now we're talking several hundred volunteers of healthy people. Again, they look for safety of the vaccine, so they're monitoring for side effects, and then they start looking for efficacy. So they want to see, does it work? So they're looking at antibody levels in that. Once they pass through the phase two gate, then they move on to the phase three gate, and that's where they'll take thousands of volunteers, of healthy volunteers in this case. They'll give them the vaccine. They may give a large group a placebo, and then they compare the two, and they'll look for, again, safety to make sure they're not having any adverse events. They'll look for side effects of it, and then they'll also look for efficacy. So does it work? Is it preventing COVID in patients? And so I'll discuss here the two that have made it through this process so far, and that's the Pfizer and the Moderna. We have the Pfizer here at Benning is what we've started issuing out. So at a certain point when they hit phase three, the researchers and the manufacturers go to the FDA and they say, hey, there's a public health emergency, and we have a product that we believe is effective, and we take a look at it. And so they petition the FDA. The FDA takes all the available data. They pour through it. They convene a panel of experts from all over the U.S. and actually all over the world. And then that panel of experts makes recommendations to the FDA. In the case of the Pfizer and the Moderna vaccine, the FDA came back and said, we've looked at the risks, we've looked at the benefits, and the benefits of this vaccine at this time outweigh any risks of this vaccine. And so they approved it for emergency use authorization. Now, the process continues with the FDA to go through a full approval process, and that's ongoing right now. I don't know when that's going to come through, but that process is going on. And then the other key thing that we look for to see that it's safe is there's a couple different mechanisms that have been in place. One is the VAERS, the Vaccine Adverse Event Reporting System, and this is in place for all vaccines throughout the U.S. where they're monitored, and any side effects are reported by primary care providers providers, the clinic that gave you the vaccine, or individual patients themselves. And this gives the FDA the ability to real-time monitor the vaccine as it's rolled out and look for any adverse events. So as to date, you've probably seen in the news, we're a little over 10 million doses, and they continue to monitor this throughout.
Sure, thank you very much. Great details on that process. Another question we have for you. Can you explain how this vaccine works?
Yeah, absolutely. Without getting into too much boring detail, hopefully, it is pretty exciting how this vaccine works. So this vaccine is a messenger RNA vaccine, and what messenger RNA is it's a set of instructions that can go into a cell in your body and tell your body what proteins to make. This technology has been around for a long time, since about the mid-70s. Researchers have been using this technology, very hopeful and promising in the field of treating cancer and a lot of other diseases. So they already had this teed up by the time that COVID hit, and they looked to this to provide a rapid vaccine. So what happens is that mRNA, they engineer that mRNA, that contains a set of instructions. They then put that mRNA within a lipid, like a fatty capsule, and that's actually what goes in the syringe. They inject that in the muscle, and that mRNA gets absorbed into your muscle cells. That RNA then tells those cells to start making proteins. And the proteins that they tell them to make are called spike proteins. And if you've seen the cartoons of COVID, it's basically a big round ball and then these kind of spikes that shoot off of it that look like flowers or fireworks. What that protein is, the spike protein, is that tip, the little extension out from it. So basically, we're telling the body to start making those. As we make those spike proteins from the mRNA, our body starts making antibodies against those spike proteins. So we're basically introducing that to our body, and our body's immune system recognizes that it's foreign and starts making antibodies to it. About 3 weeks later, you get another dose of it, and so we make more of the spike proteins. What that does is it gives us a higher antibody level, and it's a more maintained antibody level. That way, when you're exposed to the COVID virus, your body has already made antibodies to the spike proteins, and that way it can rapidly attack the COVID virus before it really takes hold and gives you a severe infection.
Sir, thank you very much. Great details on that. Our next question, who is allowed to get the vaccine on post, and where can I get the vaccine on post? Who is allowed to get it on post, and then where can I get it?
Yeah, so another good question, and something that is in constant flux. So the one so far that we've been able to get through is a good portion of phase 1. And in phase 1, you have people that are emergency medical services, key essential personnel, medical providers, and then the key and essential personnel that the CG named. And so we've been working through that group. So that's the group right now. And the way that they get it is basically through their chain of command. So as we get vaccine in, we contact the chain of command and we start scheduling, working with the G3, and we start scheduling those personnel who volunteer to get the vaccine to come in and get the vaccine so we can rapidly immunize those that are on the list as we get the vaccine.
Sure, that's very good. Thank you very much. We had a question that came in. I think it applies to this set of questions. Will soldiers be forced to receive the vaccine, or will it be mandatory? Will soldiers be forced to take the vaccine?
Yeah, so...
Hey, Doc, let me take that one.
Yeah, you got it, sir.
Hey, thanks. So first off, this vaccine right now is absolutely voluntary for soldiers, civilians, dependents, right? So it is absolutely voluntary. Nobody can order you to take the vaccine, right? This is a personal decision. I mean, every one of us has to go through this decision-making process and determine if it's right for you to take this vaccine. What I would tell you though is, just like the doc just ran through a whole litany of, the history of how these vaccines have been developed, where we're going, how well it's been tested, the fact that we're in the tens of millions of these being administered, I'd ask you to get informed before you make the decision to opt in or to opt out. But again, right now this is a voluntary vaccination for all of our folks, and so you're being the doc just laid out the essential personnel, the medical providers, the Department of Emergency Services folks who were initially offered to have the vaccine. And again, it is a personal choice to opt in or opt out, completely voluntary. Thanks, Ben.
Yes, sir. Thank you. And with everything that Dr. Miles has described for us, and then with your comments, and it is voluntary. Why have you received the shot, and why did you get the vaccine? Have you volunteered for the vaccine? Did you get it, sir?
Yeah, Ben, I did. I got vaccinated about 2 weeks ago, and again, why did I do it? Well, first off, I'm very confident in the science behind it. Just like the doc laid out, I did some research. I read all the information that's available, and I'm pretty confident in the science of it, the safety of our system in the United States to approve this going forward, right? But then, for me, for my job, I've got to travel, and I know that every time I go to the airport and get on a plane, or if I stop somewhere, I'm exposing myself to this virus, given the widespread nature of it, right? And so I wanted the vaccine to facilitate my fulfillment of my duties, right? And so I need to protect myself from the coronavirus so that I can do my job, but also so when I'm going out and traveling, I'm coming back, I'm protecting my coworkers, right? I'm not becoming a vector into my own work group. And then the same thing when I go home. I've got school age kids in my house, and my wife is there. I've got to, in my mind, it's the right thing for me to do to protect my family. And again, that's the right decision for me. And that's I've gone through a thought process. I've educated myself, but that's my choice. And so every individual has got to make their own choice of what's right for them and their family.
Sure, thank you. Dr. Miles, have you volunteered to get the shot? And if so, why did you get the shot?
Yeah, sure did, Ben. I got first dose a little over 2 weeks ago. Really, there's four main kind of reasons that I got the vaccine. Number one, my personal safety. So while yes, a lot of young, healthy, and not so young like me, but healthy people tolerate COVID well, there's also multiple that don't. So there's a lot of patients that are young and healthy that do get sick, and some that die from it. So number one is a personal safety thing. I'm also more concerned about the long-term effects of actually contracting the virus than I am from getting the vaccine. I believe the vaccine is safe, and it's gone through a good process so far. Number two, I'm a medical provider. So I want to ensure that I'm able to respond, take care of patients. I want to make sure that I can minimize any risk to patients and coworkers. Number three, I want to minimize the risk of myself passing COVID-19 onto someone else who isn't as healthy as me. So someone that's old, someone that's got some medical conditions where they may not do so well if they get COVID. Because as much as you try to lock down and protect others and stay away from them and socially distance, you still, day to day, you wind up putting people at risk. And then the third thing, honestly, I'm tired of COVID. I want to do my part to get Fort Benning and Nation back together and back to normal again. Nobody likes the idea of wearing masks, restrictions, and all the disruptions in our mission. So I think this is a key step in order for us to move on and get on with the mission.
Dr. Miles, General Donahoe, thank you very much. Sounds like personal safety, responsibility, protect coworkers and protect family, and it seems like it's sort of the gateway back to normalcy to volunteer and take the vaccine. know that's very informative to our audience. So thank you very much. I think we'll transition to a different set of questions now and discuss current general order. What was the purpose of General Order number 7? Sir?
Yeah, let me take that first, and then Colonel Scalia, if you've got any amplifying points, that might be helpful. So again, as I commented in my opening remarks, we knew that given our plan to go on HBL, that we were going to have to put in a series of pretty draconian controls when we came back off of holiday block leave. Gave us the ability to go out and enjoy holidays with our families, hopefully taking all proper measures to remain COVID-free. But then when we came back, we went to General Order number 7 on the 4th of January, right after we had received back in all of the trainees that had gone on holiday block leave. And then the intent of it was to basically lock us down, restrict our movement, restrict our interactions, both on and off the installation, max telework, make sure that any classes that we could push to the right of the Martin Luther King weekend we did, so that we were ensuring that we took those 2 weeks to understand the manifestation of the disease after we had sent thousands of folks out to the country and brought them back. And I think that did what we intended to do. Now, given the state of the disease and the fact that we reached the height of the pandemic now about 11 days ago or so here in southwest Georgia, this enabled us or directed us to take into consideration the state of the disease, and we extended General Order number 7 1 week to the right, although we then took down from HPCon Charlie to HPCon Bravo, our health protection controls, in order to get our schools, our DODEA schools, back in session so that we could remain basically in step with our local communities, which did mainly the same for their school-aged children. Again, we knew this was not without risk, and therefore we had to do some pretty significant. We had to put in place some pretty significant measures when we got back. Colonel Scalia, you want to amplify or?
Yes, sir. Yes, sir. Thank you, sir, for everything you said. Right, it was great leaning forward, kung fu stance. It proved to be the right call as we've seen the huge spike in numbers, but it also it's great cooperation with the local community, and local leaders have thanked us for taking these measures because they understand we are one community, and we can do a little bit more here to try to take those measures to reduce the spread.
Sure, Colonel Scalia, thank you very much. Our next question, will kids be in school for the rest of the year? I know school is always an important topic. Everyone's asking about that. Will kids be in school for the rest of the year?
Hey, Ben, I'll take that. Great question. If you'll remember 10 months ago, it all happened very abruptly, both on and off post, going to remote learning and having to figure out how that was going to work. We're all very cognizant of the challenges of families when their kids are having to learn remotely. Some do well, some don't do so well. Never mind the strain just on as parents if we have to stay home for that. I'm going to give you a lawyer or even a doctor answer, and it depends. It all depends on the disease, and the commanding general has made that clear, right? It's not our desires, it's the disease that will drive these things. So our best effort to ensure our children can remain in class is to take these individual measures to help reduce the spread. DODEA will have. Their decision will be a bit different from Muskogee County, from Chattahoochee County, from Harris County, Lee County, et cetera. But we're in touch with all of them. We want to stay in line with our surrounding counties, in particular Muskogee, because that's where the majority of our workforce and families reside, and their children go to school. But we're in touch with them all. We try to stay in step, but it's all going to depend on how we combat this disease. So, for example, I know Chattahoochee County came back a bit and went to remote instruction because of some increase in numbers. But simultaneous to that, near simultaneous, Muskogee County was bringing their elementary school students back. I understand next week their middle school and high schoolers will return. So they're all making different calls, but we'll all be in step when the numbers reduce. So we're optimistic, though.
Sure. Thank you very much. Our next question, are off-post children's activities allowed? Off-post activities like gymnastics or cheerleading, or off-post children's activities allowed? Sir?
Hey, Ben, I'll take that one as well. So, yes, for the most part, but this is where we really need parents to use their judgment and meet the intent of the general order. Okay, I've got children participating in outdoor activities off post, but not all the time. So we're engaged with the coaches. Even just yesterday, the coach was wanted to do the beginning of the season social. Well, hey, that's great. Practice outdoors is one thing. Social indoors is something totally separate. So, hey, coach, my daughter will not be attending, and he totally understands. Even engaging other activities, where there's more financial interest of, we're paying for swim lessons. Don't penalize us if we don't feel comfortable sending our children. We don't think it's within the intent of the general order, or can you show us the good mitigation measures? So we still want children to be engaged. We're not trying to ruin their childhood with these measures, but we do ask parents to really meet the intent of the general order. So there's no blanket prohibiting children from participating in these. Just use good judgment.
Hey, let me add to Colonel Scalia's comments because they're spot on. So same thing. I've got one of my daughters is in high school sports out in town. Outdoor practice, get after it, right? They're out there, they're running around, they're running around on a field, so they're basically socially distanced anyway, right? And they're outside, and so that's great. And then of course we had a similar thing where all of a sudden the coach wants to have a team meeting with parents at a restaurant downtown, and so we had to contact the coach and say, hey, we can't do that, and it's probably not prudent to do that given the state of the disease right now in southwest Georgia. And so, we'd ask everybody to make those decisions for your children that makes sense, but they should be COVID informed and informed by our general orders that we're putting out to help protect the force. And so that's all part of our own personal responsibilities. And me personally, I found the vast majority of the folks we're dealing with to be very reasonable about that. And everybody, both folks at Fort Benning, folks in Columbus, folks in Phoenix City, they've all got to go through that same decision process of, hey, is this a risk I'm willing to underwrite, or is it a risk I'm not going to assume for my family?
Sir, great. Thank you very much. Gentlemen, thank you very much. Our next question, our kids are getting restless. Which MWR programs are available for families?
Okay, Ben, so this is mine. So yes, children are restless. Everybody, we have a lot of great activities on post, and there's still a lot going off post. I'll just start with off post. Just last weekend, took a hike in Providence Canyon. Good little day trip for the kids, and you got a 3-mile loop, or you can go a 6 or 7 mile loop. Pretty neat scenery, but good outdoor activity. On post, a lot of good things to do. Please check out Kings Pond. Check out Russ Pond. Kids can fish at Russ Pond without a license, and it's a pretty well stocked pond there. Kings Pond has got a family day coming up, family fun day on February 6th, where MWR will be bringing kayaks out there. They're even going to bring up kayaks, canoes, and an archery station as well. Check out MWR website for more information. Bowling alleys are closed currently, but when we reduce some measures, anticipate the bowling alleys opening up again for use, please look at Smith Gym Pool. Okay, the outdoor pools are closed obviously for the season, but we do have Smith Gym Pool not just open for lap swimming, but there is a recreational pool there for use. You do have to register for it. It's not it's free. It's not difficult. Please just get check out information on the MWR website. Check out the golf course. If you're not a golfer, we've got foot and disc golf in the back 18 holes. That's open at any time, no reservations needed. So bottom line, everybody, please check out the MWR website. A lot of good activities to get your kids out of the house and active. That's all, Beard.
Sure, great. Thank you. We did have a question come in, and since you did address the schools, we had a question come in from Andrea. To those who have been homeschooling our children, will we have a hard time putting our children into school after the pandemic is over? Sir, can you address that?
Absolutely. So that's a great question, and that'll really depend on which school district. So first, get the right answer directly with the school district. I will tell you, though, they're each doing it a bit differently, right? So DODEA specifically on post provides the opportunity of either the virtual learning or in school. Now, when conditions such as now, up until this week, are such that the in-person needs to be remote, that is still separate from virtual. So when the conditions are bad on post, high numbers of COVID, in-person will be remotely. They're taking classes on the computer with their actual teachers, separate from virtual, which is totally different teacher workforce for the children. And DODEA does provide the opportunities, a hard decision date for your children to return if they want to go from virtual to in-person/remote. As far as the other school districts go, again, you'll just have to reach out with them directly, but I think that flexibility is available for you.
Sir, magnificent. Thank you very much. And we can follow up with Andrea with some additional information in the comments after. And as always, this video, although live now, will still be recorded on our Garrison Facebook page, and they can come back and reference that. We'll continue with some questions. We spoke about MWR programs. I think this goes back to some other activities. Which activities are considered essential?
Okay, so good question. The general order does lay out some specifics, of course. Shopping, food shopping. If medical needs, of course. If you have some grooming things, barber shops are still open. If it comes to access onto post, when we had suspended visitors and trusted traveler, we're still allowing visitors for essential activities at home. Okay, I mean, even if you have a tutor for a child, if you've got a home help, things of that nature, we'd really just restricted participation or visitors of a social or recreational nature. But again, I mean, this is the general orders can't list every single item. It's really designed for us to use our judgment to prevent us from going to places really just truly not necessary for us to be at.
Sure, thank you very much. Our next question. What if I or my dependent have an appointment outside of the travel radius? Do we need an exception to policy?
Yeah. Hey, thanks, Ben. I'll take that. So right now, under General Order Number 7, as I said in the opening comments, right, we've restricted ourselves to a 50-mile radius around the installation. So if you're traveling out of that area for any reason, you need an exception of policy. Right, again, the intent of this was a very short period of time to lock us down. But we have granted exceptions for folks to go to Atlanta for medical care, go to Atlanta to take care of an ailing parent. We've been willing to entertain those and give exceptions where it made sense to do so. Again, I would ask you if it's not something that is really time sensitive, to work with us, reduce your exposure, and wait until we come off of General Order number 7 and lift the travel restriction. But again, that 50-mile radius was all about forcing us to hunker down. It was by design. But exceptions are out there for those folks. Folks need them. You just got to work through your chain of command.
Sir, thank you very much for the information and clarification. Another question, is it premature to return to full in-person working conditions, given the high rate of the virus in our area and the fact that we have yet to fully vaccinate?
Yeah, I'll take that as well. I think it is premature to do that right now, given the state of the disease, off the installation, and the challenges we're working through with our own workforce. Absolutely, we don't need to return to full up. Everybody sitting at their desk, manning their computer on the installation. And so we've devolved that down to our directors to work through the process of determining who they really need in and who can still telework. And so that it makes all the sense in the world to work with each individual working in every section to determine how best they can continue to work and mitigate the risk during this pandemic. Now I will tell you, I mean, the comment of fully vaccinate will be that's a challenge, right? I mean, so with a voluntary vaccination program, we're obviously at some point we'll be back at work and we'll have folks who have not chosen to take the vaccine, and those will be personal decisions, and we've got to work through that. But just understand that if you choose not to take the vaccine, that doesn't mean you're automatically going to telework, right? So we're going to have to work through all those, and we'd ask you as an employee to work with your supervisor to make sure that your situation is understood and taken into consideration as we make decisions on telework and in-person work.
Sir, thank you very much. We've only got time for about one more question. We're still monitoring some of the comments, but is there a change to General Order number 7 coming, and if so, when? What changes can we anticipate? Will there be changes in perhaps the CYS services? Are there any changes on the horizon?
Hey, Colonel Scalia, can you talk about CYS and our CDCs and how we're working through the process to broaden attendance to those, and then I'll talk about General Order number 8 that's coming.
Absolutely, sir. So for our CDCs, our youth services, we actually just earlier this week expanded that back to where we had been prior to the holiday block leave. Okay, so roughly 75%. We had reduced to 50% in that 2-week Kung Fu stance period, and made the determination and the commanding general's blessing to extend back to 75%. That was in large part to support the schools, students going back into schools, and because we felt we were able to mitigate properly, and that is, I think, showed itself out well. So we're still at 75%, and families have already been notified. When we get back to 100%, not until we're able to really put COVID into the ground. But we're pretty good at 75%, which is determined. Primacy goes to single soldiers, single soldier parents, dual military, and then prioritize it in that way. Okay. When we get back to 100%, we'll be able to open up to much more and get into the lower priority people. But we're back to where we had been prior to the break. Sir,
if I could interrupt on that. I know you want to talk about the general order, but we've got several comments. Colonel Scalia, if you could just reiterate, I think we are already there, but with trusted traveler, I think that was reinstated earlier this week. Could you address that, please?
Yes, it was. Trusted traveler was reinstated this week as we moved with the General Order Number 7, Change 1. That was trusted traveler was one of those things we did lift or reinstate to allow visitors back on with their ID card, CAC card member. Now, just to add on that, because I think there's some confusion. So, Trusted Traveler is open from 05 in the morning to 2200. After that, everybody will need to show identification, and if they're not, don't have the card allowing access to the gate, they'll have to get a visitor's pass.
Yes, sir. Thank you. General Donahoe, I didn't mean to cut you off. I apologize, but we've got so many comments about Trusted Traveler. I just wanted to try to grab that real quick. Again, back to the last question that we were having. Are we anticipating any changes to the order? If so, when can we anticipate those, sir?
Yes, we're going to post General Order Number 8 tomorrow afternoon. It will take effect Monday morning, right? 0001 on Monday morning. So we'll remain General Order Number 7 through this weekend. All right, so just one more weekend of playing Jenga with your family and not exposing yourself downtown at restaurants, right? So General Order Number 8 will do a couple of things. It will return us very much to the posture we had during General Order Number 6, right? So we'll lift the travel restriction of 50 miles, and really it'll just devolve that responsibility back down on chains of command to work through each individual on TDY travel, on leave travel, et cetera, where folks are going, right? Again, when the rationale there is, we went to 50 miles just to keep us all stationary. Well, we fully understand that you're as at risk eating in a restaurant in Columbus as you are eating in a restaurant in San Francisco, right? And so we understand there's a risk that we've got to take. We still have in the general order the requirement for you to take all the precautions we would ask you to take to remain COVID free, right? So we're going to return to restaurants, being able to eat in restaurants downtown. We're going to return to indoor gyms downtown, and again, we would just ask you as we loosen up those restrictions again, you've got to fully understand that we still have a very high case rate off the installation. And so, as you do those, you expose yourself to risk. We would ask you to make sure you take every possible measure to enjoy your life, but remain COVID free while you're doing it, right? And so again, we'll see that tomorrow. The reason we're waiting until tomorrow night is we want to make sure that if with the change of presidential administration in the executive branch of the government, that if there are directives that are coming out from the federal government that are different than the previous administrations, that impact what we can and can't do as federal employees, we want to make sure that we incorporate that in the general order. And so that's why we're not going to get it out until tomorrow afternoon, to make sure that we're not having to give you another change over the weekend in mid-stride. Okay, so again. I personally, and I think the command really appreciates the amount of discipline that we have shown, right? And this really is about resilience. I go back to I personally started hunkering down for COVID a year ago because I was in Korea a year ago. This is when this all started in Korea in late January. I got it. I am, and Colonel Miles talked about getting the vaccine because he's tired of COVID. We're all tired of it. But again, we lost a member of our team a couple of weeks ago to this disease. It is a significant health threat, and we've got to do what we can to mitigate its impact on our community. So I thank you for being willing to follow the rules and do everything you can to keep yourself and your family and your teammates healthy through this period of time. And again, there's a couple of pathways out of this, and I think one of them critically is widespread vaccination as well as widespread use of masks and social distancing as we go forward. So thanks, Ben.
Sir, thank you. I know those are some welcome comments, but got to keep your eye on the ball and wear your mask, social distance, wash your hands, do all those mitigations, as well as, like you said, the gateway. Get the shot. Everybody's doing it. It's a cool thing to do. We're done with our questions right now. Colonel Miles and then Colonel Scalia, if y'all have any closing comments, then we'll turn it over to Jill Donahoe for some final comments with this town hall. Colonel Miles, Doc Miles, please.
Thanks, sir. Appreciate the opportunity to talk with everybody. The final thing I'll say, I've been getting a lot of questions of, am I eligible for the vaccine? I have a certain medical condition or I have some kind of issue. Can I still get the vaccine? The best thing to do in my mind is go ahead and show up for the vaccine. When you go to get the vaccine, you'll be screened and there'll be a provider there that can talk with you about your individual issue and if you're qualified or disqualified based on medical conditions. And that's all I got. Thanks, Ben.
Sure. Thank you very much. Colonel Scalia?
Hey, thanks, Ben. So I'd like to thank everybody for their cooperation, specifically on the installation with respect to individual discipline, right? As Ben had just talked about, face mask, washing hands, social distancing. So we've got people going around. I've got a safety office that kind of checks on location, see if are people doing the right thing, and it's the exception that we'll get a report back if somebody's masked below the nose or not socially distanced. They're able to make on the spot corrections. People understand, but I would ask people, hey, we need to kind of police ourselves up, right? We need to not rely on somebody else to make a correction, but we know what the right thing to do is. So especially soldiers, right? We can make those on-the-spot corrections. It has largely seemed to become a way of life for us, so it's become easier, certainly a lot easier than we were having to handle back in the April, May timeframe. So just like to thank everybody for that. The situation is fluid, right? So whether tested traveler on and off, what's the HP con level, what's open, what's closed. I would ask you, go to the websites, know where those websites are to get the latest information. Our public affairs office does a great job of keeping it updated. You go to the benning.army.mil/coronavirus or COVID, and that'll take you for the latest information. Please also look, because I do love the question about kids climbing up the walls at home. MWR really provides some fantastic events for us, and Fort Benning has a lot of great outdoor activities for the families and off post as well. Ben, I'd like to thank you and your beard. Thanks.
Sir, thank you very much. Appreciate the compliment. And it's become a way of life with the mask and washing hands and social distancing. I think everybody understands those mitigations and how important it is, and now how important it is to get the vaccine, like we said, the sort of the gateway back to normalcy. Jill Donahoe, sir, your closing comments?
Yeah, hey, thanks, Ben, and your beard. Hey, so holiday block leave, 18 December through 2 January. Vast majority of folks associated with Fort Benning were able to take advantage of either all that time or some of that time to get some quality downtime away from work and enjoy family in the holidays. Right? That was a risk. It was a calculated risk. We fully understood what we were exposing ourselves to, but then through the staff, for the garrison and the maneuver center, and put together a series of mitigation measures and controls upon return. And that was General Order number 7. That's what put us into our, Kung Fu stance. That gave us the ability to really weather what could have been something pretty traumatic. And I'll tell you, what we were able to do made this past 2.5, 3 weeks truly manageable by the team. And again, it goes back to the discipline of the soldiers who went home, the trainees that went home, our cadre that took time off, and our civilians and our family members to do the right thing, even on the block leave period, to remain COVID free. And so we're coming out of that General Order number 7 because we've been able to mitigate the impact of the disease on the installation. And so General Order number 8 will be out tomorrow afternoon, effective on Monday. So again, we've been talking through this, and I really do appreciate Doc Miles walking us through really the science behind this vaccine. And I would just offer to you, as you are offered the vaccine, make an informed decision for yourself. Right? There's an awful lot of disinformation out there on the internet. Bowl through that, get to the real information that's available from the CDC and the FDA and what Colonel Miles has put out, so that you make an informed decision that's right for you. Because the vaccine is one of the tools out of the pandemic. And so again, I appreciate you tuning into this today. We appreciate your comments and your questions. And again, that helps us understand the concerns of the community, and for our ability to try to address those concerns through either actions or our messaging. So thanks for what you do. Thanks for what you do for the Army and Fort Benning. One force, one fight.
Sir, thank you very much for the comments, and panel, thank you for addressing so many questions from our audience today. To our Facebook audience, thank you for joining us. We appreciate your participation, and although there are many questions we did answer, I'm sure there are some that we did not get to in this forum, but we will address those comments for you as quickly as possible. Thank you. We look forward to you joining us for our next town hall. One force, one fight.